If you're suffering from hearing loss, you may hear from your doctor about tinnitus or tinnitus. So what is that and how do you deal with it? I'm joined here in the studio by audiologist Dr. David Anderson to tell us more. Thank you for joining us this morning.
Thank you. Thank you for having me here.
So let's start out talking about what is tinnitus or tinnitus.
Tinnitus is a condition where one experiences a ringing in the ear, for example. This type of sound that you're hearing now, that's a form of tinnitus. It's a ringing or buzzing, a hissing. Tinnitus may express itself as even a cricket-like sound, which can occur in one ear, both ears, or even located more centrally within the head itself.
And does this affect all ages? When does it sort of happen? What are the contributing factors?
It can affect all ages. More frequently, it can be a result as the aging process. Tinnitus, contributing factor of tinnitus may be that of noise exposure, which many of us have had that experience where perhaps we've attended a concert or we've fired a gun and shortly thereafter we sense this ringing sensation in the ear. Tinnitus can be associated with hearing loss, with ear disease, even though tinnitus is not a disease itself, it's a symptom. And medications, blood pressure, elevations, that sort of thing can also attribute to tinnitus.
You brought these devices with you this morning. Could you explain what they are?
These devices here, in terms of treating tinnitus, there is no cure for tinnitus, but this particular device here is a device manufactured by Widex, the Widex Mind system, and it's one of the means of treating tinnitus to give the individual who is suffering from tinnitus relief. This type of device uses harmonic tones, which helps to calm and assist in coping and relieving the tinnitus.
And this just sort of sticks in your ear, it kind of stays there?
That's an ear, above the ear, over the ear related technology, and also there are some that fit within the ear. This technology can also be used with patients suffering from hearing loss as well, and use the tinnitus masking effect with the Zen processing as well as the effects of extended high-frequency amplification.
So I imagine with time the technology and the treatment has really improved, and you've been practicing for a while.
Yes, since 1975. So we've seen great strides and great improvements where initially in my practice it was such that there wasn't much we could say or contribute to assisting a patient with tinnitus, but with many of the new technologies and treatments, the tinnitus sufferer can receive relief.
And your practice is here in town, in the Valley?
In Las Vegas,
Las Vegas. So what's your advice to someone who might be hearing this sensation? Go see your doctor.
I think the main thing is to have your tinnitus properly evaluated in terms of seeing what the possible causes of the tinnitus may be.
Dr. Anderson, thank you so much for joining us this morning. We'll be right back with your weekend weather forecast.